Evidence suggests that a high intake of dietary fat, sugar and protein, which typifies the Western dietary pattern, can promote acne in a manner similar to excessive androgen production. This is thought to occur via molecular pathways involving a protein called mTORC1, an insulin-like growth factor 1, and this ultimately increases the sebum production in the sebaceous gland. Therefore, limiting meat and foods high in fat and sugar in favor of low glycemic plant-based foods might help to alleviate the acne for some individuals. Intriguingly, the anti-diabetic drug metformin and the natural compound resveratrol found in red grapes and Japanese knotweed, as well as epigallocatechin gallate or EGCG found in green tea, all inhibit the mTORC1 signaling, thus complementing a healthy plant-based diet with these agents might confer additional support for healthy skin. Excess oils on the skin, either naturally produced or derived from oil-based moisturizers, cosmetics or hair products, can exacerbate acne. Contact irritation from clothing or equipment such as a helmet strap can worsen the acne. Scrubbing the acne is not advised as it could spread the acne and increase the probability of more severe symptoms. There's some evidence that stress and other adverse mental health issues can lead to a breakout or worsening of the condition. Gently washing the affected area twice a day with a mild cleanser or gel is suggested for all forms of acne. Many preparations used for cleansing acne-prone skin contain substances that are proven effective for treating the acne. Many cleansing products on the market have scrubbing particles incorporated. However, if acne is moderate to severe, it might not be a good course of action as it could worsen the lesions and increase the risk of scarring. The multifactorial nature of acne suggests there's multiple opportunities to intervene in its development. Several natural compounds have the potential to excel in acne management by targeting various aspects during the acne development. For example, some natural compounds possess antimicrobial or bactericidal activity, while others exert powerful anti-inflammatory action. The rationale for fish oil supplementation as a treatment for acne stems from the observation that people who habitually consume a diet containing fish have lower overall incidence of acne. A study on 93 acne patients showed individuals who consume a Mediterranean diet, which is plant-based diet rich in omega-3s, are less prone to acne than those who follow other dietary patterns. In a clinical trial, 13 patients with inflammatory acne were given 930 milligrams of the omega-3 fatty acid EPA every day for 3 months. Some of the subjects experienced modest improvements in the acne severity following the treatment. A small-scale trial on 5 subjects with mild to moderate acne showed that treatment with 1,000 milligrams of EPA every day for 2 months led to a reduction in inflammation and the total number of acne lesions. Zinc is a mineral with several properties, and it could potentially relieve acne. For example, it exerts anti-inflammatory and antioxidant action, antibacterial effects against the P. acne bacteria. It modulates the immune system and it reduces the production of sebum. It also appears to complement some antibiotics in the treatment of acne. Plasma zinc levels have been found to be significantly reduced in severe acne sufferers compared to those with mild to moderate acne in a study on 94 subjects. A double-blind trial on 37 subjects with moderate and severe acne compared zinc to tetracycline antibiotic. Both treatments reduced the acne severity by about 70%. Another placebo-controlled double-blind trial on 56 acne sufferers demonstrated a significant effect of zinc on the acne lesion count. In this trial, 29 subjects were receiving 600 milligrams of zinc sulfate every day, and they achieved significant reductions in acne lesion counts after 12 weeks of treatment compared to 27 subjects who were taking a placebo. In a prospective open-label trial, 48 mild to moderate acne sufferers were given 3 doses of 75 milligrams methionine-bound zinc complex that contained 15 milligrams of elemental zinc together with antioxidants for 3 months. The researchers noted a significant decrease of lesion count in 79% of the subjects. In another open-label trial, 30 subjects with inflammatory acne took 30 milligrams of elemental zinc every day for 2 months. The lesions decreased significantly by day 30 of the trial, and this reduction was even more pronounced at the end of the trial. As part of the same study, the zinc was found to decrease the resistance to the P. acne bacteria to erythromycin in cell culture. Zinc is also effective when it's applied to topical solutions for acne. A solution of 1.2% zinc acetate and 4% erythromycin applied twice a day resulted in an over 64% reduction in acne lesion counts after 12 weeks. In a randomized, observer-blind efficacy trial, 246 mild to moderate acne patients had a 1% clindamycin zinc gel applied once or twice a day, and this was shown to be equally safe and effective as the 1% clindamycin lotion. Both were applied for 16 weeks. The addition of the zinc to the topical formula also seems to decrease the systemic absorption of other active compounds that can be included, such as antibiotics, and this might lower the risk of systemic side effects and increase the local availability of the antibiotic molecules. Lactoferrin is a protein with antimicrobial and anti-inflammatory effects. It's a component of the innate immune system, and it's found in natural products like milk. In a trial on 39 subjects with acne, twice daily lactoferrin tablets over 8 weeks resulted in a significant decrease in the number of acne lesions in almost 77% of subjects. In a placebo-controlled randomized trial, 18 subjects received 200 milligrams of lactoferrin daily. The acne lesions decreased significantly in the lactoferrin group only. Interestingly, sebum levels also decreased by 31% in the lactoferrin group compared to the placebo group. Tea tree oil has antimicrobial and anti-inflammatory properties. The terpenoids modulate the signaling of NF-kappa B, a major mediator of inflammatory signaling. In a randomized trial of 60 mild to moderate acne sufferers, the treatment group, 30 individuals, applied a topical 5% tea tree oil gel for 45 days, and they experienced a significant reduction in the total lesion count and acne severity compared to the placebo group. Another single-blind trial in which 124 subjects with mild to moderate acne were randomly assigned either a 5% topical tea tree oil gel or 5% benzoyl peroxide showed both formulas significantly reduced the total lesion count, and the tea tree formula caused slightly fewer side effects. Niacinamide is a compound derived from niacin or vitamin B3. It's been shown to exert anti-inflammatory action within the skin. In a randomized control trial, 65 subjects had a 5% nicotinamide, and it performed comparably to a 2% clindamycin, both as topical formulations, for reducing the acne severity. As a dietary supplement, 600 milligrams 1 to 4 times per day reduced the symptoms by over 80% after 8 weeks in a clinical trial on 235 subjects. This was an open-label trial which the nicotinamide supplement was compared to the existing acne medication. The nicotinamide succeeded in significantly reducing the acne lesion counts and improving the appearance as reported by the subjects. In a Japanese double-blind placebo-controlled trial examining sebum production, 50 subjects received a topical 2% nicotinamide moisturizer every day, and 50 subjects received a placebo. After 2 weeks of treatment, sebum production of the nicotinamide group was reduced significantly in comparison to the placebo group. A separate randomized double-blind multicenter trial compared a 4% nicotinamide emulsion to a 1% clindamycin formulation, both applied daily as topical formulas. The nicotinamide formula was found to be superior in terms of safety, tolerability, and efficacy. The evidence for vitamin A's efficacy in acne is mixed. In support of vitamin A's role in treating acne are findings which suggest it can reduce inflammation caused by the P. acne bacteria. Also, vitamin A levels have been found to be significantly lower in the skin and the plasma of acne patients compared to acne-free controls. Some older evidence suggests the efficacy for oral vitamin A in acne, but it relied upon very high doses that would not topically be recommended. On the other hand, a trial on 211 acne sufferers found a topical vitamin A treatment for 8 weeks led to improvement when compared to placebo or standard therapy. Vitamin E is generally important for the skin health, and a deficiency in the antioxidant has been correlated with an increasing severity of acne. A side effect of isotretinoin treatment might be a loss of vitamin E. Therefore, vitamin E supplementation might be advisable for those who are receiving this medication. Aloe vera extracts are often used in skin treatments, mainly to relieve minor burns or irritation. In a randomized, double-blind trial of 60 patients with mild to moderate acne, a topical gel with 50% aloe vera and a 0.05 tretinoin significantly reduced both the comedones and the inflammatory lesions more effectively than the tretinoin alone after 8 weeks of treatment. The aloe vera gel also caused significantly less redness as a side effect. Barberry extract has anti-inflammatory and antibacterial properties, and it can reduce serum production. Daily oral capsules containing 600 milligrams of the barberry extract were given to 25 patients in a small-scale trial, and changes in their acne symptoms were compared to 24 similarly afflicted subjects on a placebo. The mean number of acne lesion counts and acne severity scores of the subjects taking the barberry for 4 weeks were each reduced by 44%. Although berberine has been studied in human clinical trials and shown to have several metabolic benefits, concerns about the long-term use of berberine have been raised on the basis of certain preclinical studies. Some evidence suggests that long-term berberine use, especially at high doses, might impair particular aspects of cellular metabolism in specific types of cells. The implication of the preclinical research is yet to be determined by long-term human clinical trials. Therefore, only short-term use would be recommended. Green tea and its active ingredients, the catechins, are associated with inflammatory response regulation through NF-kappa B. Topical application of the green tea extract can have a potential for treating acne. In a single, blind, randomized trial on 20 subjects per group, comparing 2% tea lotion, the tea preparation significantly reduced the inflammatory lesions in the subjects with acne. Another one-way trial on 20 subjects applied a 2% green tea lotion twice a day for 6 weeks, and it demonstrated significant effects of the tea on the acne severity and the lesion count. Extracts from various seaweeds have recently attracted interest as a skin treatment. There's evidence that molecules called seaweed oligosaccharides, which are linked to zinc, can significantly reduce the sebum production. Also, some species have shown anti-inflammatory and antimicrobial activity. A double-blind trial compared 30 subjects who used a topical seaweed-derived oligosaccharide containing 0.1% zinc pyrrolidone with an equal number using a control. There was a significant reduction in the lesions in the seaweed group. Gugolipid is a lipid-based molecule known as glucosterone, and it's understood to regulate the production of other lipid-based substances in the body, which include the sebum. In one trial, 20 subjects with acne were allocated to either 25% glucosterone or 500 milligrams tetracycline. Both were taken twice a day for 3 months, and reductions in acne lesions were comparable in both groups. For more on herbs, supplements, and natural treatment plans, check out my website.